Medical information officers will be.
We're live.
Thank you. Good evening, Mono County, and welcome to the community conversation for January 7th. Oh, I can't believe it. It's 2021. So this is our first meeting of the new year. My name is Brian Wheeler. I'm from Public Health, and I'll be your host tonight. But first, we're going to get started with a PowerPoint presentation from Stu. So Stu, go ahead and take it away.
Yeah, thank you, Brian. Thank you, panelists, for joining us again. Here we are, 2021. All right, so we've got a lot to get to. So I'll try and pause for translation from each slide. So that's kind of our cadence this evening. As again, we have a lot to get to. I have some vaccine information here at the end of the slide and ways for you to pre-register. So again, just want to make sure our Spanish speakers are following us. You want to look for the interpretation icon there when you log in. That'll get you to the Spanish interpretation module. And then you can also watch the meeting live right now on the Mono County Health Department Facebook event page. Mountain View Fire Resources. Again, our team is doing a phenomenal job keeping this resource updated for those affected by the Mountain View Fire, and information and more is also available on the Mountain View Fire Resources and Recovery Facebook page. This winter, we need everyone's help to do everything we can to keep our friends, families, neighbors, and visitors safe. To do our part, we need to stop the surge, and we need to stay safe to stay open. That means we need to wear our masks, continue to wear our masks, continue to wash our hands, continue to practice safe distancing, and to not gather indoors. These are a lot of the graphics that you'll see provided by the state, have been shared on our Mono County Health Department portals, town portals, and everywhere else we can spread that message. So again, please help us stay safe to stay open and to stop this surge. Let's just look at some of the recent metrics. Again, this is pulled from the Mono County portal under the case stats. This was as of probably around 3:30 this afternoon. You can see we're up to 703 cases. That was a bump of about 20 from yesterday. You can see it's 549 Mammoth Lakes, 91 in the North County, 58 in South and East County. This shows you the 30-day case rate. You can see we have a 30-day increase of just under 91%, which again is really kind of close to 100%. So you can see in 30 days, we are around doubling our cases every 30 days, which is not good at all. You can see our 30-day increase is 335. Test results in the last 7 days, we've tested 232 people. We've had 50 positives. And again, a very high positivity rate of just under 22%. So again, that's over 1 in 5 people that are being tested are now positive. So again, keep wearing those masks, no gathering indoors, practice and certainly promote good hygiene habits. These are some slides that we share with you each time we present this PowerPoint. These are slides from January 2nd. You can see here from November on the left-hand slide, 15th to the end of December, beginning of January. You know, we had a low positivity rate of just under 4%. And now you can see we're around, you know, the 16, 17, and most recently in the last 7 days, we're above 20% again. So you can see we're really tracking in the last 2 months at around 20% positivity rate. New positive cases for the past 6 weeks. That's a PCR confirmed only. It's not an antigen test. And you can see here the positivity rate per 100,000. That's kind of our 14-day per capita. Mammoth Hospital status is still green. And Dr. Burrows is here this evening. You can talk about that a little bit more later in the evening. Regional stay-at-home order is still in effect. Our 4-week ICU capacity projections do not meet the criteria to exit the order. As again, you can see in the third bullet, the order will be lifted when regional available adult ICU bed capacity is greater than or equal to 15% and is projected to remain above that level for the subsequent 4-week period. At the end of the stay-at-home order, each county within the region will be assigned to the tier based on the blueprint for a safer economy. You can see here we have some recent metrics from a couple of days ago, shows you the ICU capacity for the 5 regions throughout the state. San Joaquin, Southern California remain at 0%. The only region not in the stay-at-home order is our Northern California region, 25, actually just under 30% available capacity. And you can see Greater Sacramento and the Bay Area, 11.7 and 5.9% respectively. I've included some of the metrics that the state is using to calculate the ICU capacity. These are calculated daily. And those 4 factors include the current estimated regional ICU capacity available, the measure of current community transmission, the current regional case rates, and the proportion of ICU cases being admitted. So good information. And again, these statistics are available on the covid19.ca.gov website, and that is updated daily. This slide has been up a few times. Just want to again go over some of the restrictions in the stay-at-home order. It includes retail, it includes hotels and lodging, it includes restaurants, it includes offices, places of worship, and so forth. You can see here retail is still limited to indoor, 20% capacity limits, 35% for grocery, standalone grocery stores. The county lodging order is in effect. We'll talk about that in a sec. And restaurants only permitted to provide takeout or delivery services only. The county regional stay-at-home order lodging is still in effect, applies to all short-term lodging operators, is in effect until the southern region is no longer subject to the order or Mono County is otherwise released from the coverage of that order. There are some exemptions to this order. Those are COVID-19 mitigation, containment, essential workers, and for any person displaced due to loss of home or fire. Homeowners are able to use their unit during the stay-at-home order, but that's only for members of the immediate household or living unit. The state updated the travel advisory on January 6, talks about non-essential travel. Californians should avoid non-essential travel to any part of California by no more than 120 miles from one's place of residence. They also have initiated a quarantine post-travel. So any person arriving in or returning to California from other states or countries should self-quarantine for 10 days after arrival. You can see there's some exemptions there as well. And a local health officer may determine if and when the situation within the local health officer's jurisdiction warrants measures that are more restrictive than this statewide order. Business resources are available on the COVID-19 portal, anywhere from financial assistance forms, local business programs, employee assistance programs, any flyers, and any resource information for our local businesses is available on this portal. So I would highly encourage you to visit this page for that information and more. We will just spend a little bit of time covering our community first programs. Housing assistance, there's $400,000 available. This is up to $500 per month, maximum of 4 times, paid directly to the landlord. This information and the online application form is available on the mammothLakesHousing.org website, or by calling Mammoth Lakes Housing and Patricia, 934-4740. Town of Mammoth Lakes Community First programs. We've just released the list of recipients for round 4 of the Business Assistance Program. $180,000 was distributed to these businesses listed here. And round 5 is $520,000 is available. Qualified small businesses can apply for grants of up to $20,000. Applications will be accepted by 5 p.m. on Wednesday, January 13th, 2021. That application form and information is available on the Town of Mammoth Lakes website, right there on the top right-hand corner of this slide. Other business assistance programs, there's a Paycheck Protection Program, or PPE Round 2. All that information is available there. Also, the California Small Business COVID-19 Relief Grant Program. You can see the website there, careliefgrant.com. You can see the eligible businesses, their annual revenue, and the grant amount available per business. The Mono Cures program has ended. Alicia informed us that $420,000 was dispersed to 48 eligible businesses in unincorporated Mono County. Again, this information is available on the Business Resources portal and more. Food Bank, the Market Food Bank was held on January 5th. The next one is scheduled for January 19th. Hours, you can see there, 11 a.m. to 1 p.m., 11 a.m., 1 p.m. Location is Center Street behind the promenade on Main Street. You can see the website for information. Recipients will need to fill out an AMARCA paperwork, this sort of a check-in. Contact AMARCA there for any information, and donations being accepted through the Mammoth Lakes Chamber of Commerce. Testing information, we have a new testing location at the Mammoth Lakes Foundation. So I want to thank Mammoth Lakes Foundation for letting us host testing every Monday and Thursday. That's in the Mammoth Lakes Foundation parking lot. The new time is from 11 a.m. to 3 p.m. Verily continue to test at Sierra Star Golf Course. That is on Tuesday and Friday. And then Verily are also conducting testing from 9 a.m. to 12:45 p.m. At the Antelope Valley Community Center. We have initiated pre-registration for testing. You can kind of see the little QR code here. You can certainly scan that, complete your online application, your online registration. And we do encourage you to look for this new flyer. You can see it's on the right-hand side of the slide there. That's available through our notice boards throughout town. You'll see it on our social sites. So again, grab that flyer, scan that code, pre-register. And you can see here we've provided some additional maps for you to better access the locations. Again, so look for this flyer in our local media, on our local notice boards, through on our social media posts, and more. But definitely pre-register before your arrival, and it is now a self-administered PCR test at these locations. Again, all this information and more is available by clicking on the testing icon on the Mono County COVID-19 portal. Just want to spend a little bit of time here, as we said, on the COVID-19 vaccine. This information is available again on the COVID-19 portal by clicking on the vaccinations icon right here on the top right-hand corner of your screen. It'll take you to a new and improved webpage. I want to thank our IT department and our JIC team for putting it together under short notice. It is still being updated as we speak, but I'll kind of show you some of those slides. Our goal here is just to be as transparent as possible with the vaccines that we received, how we're distributing and so forth. You can see here, Mammoth Hospital has received 360 of the Pfizer. The health department's upwards of 600 doses of the Moderna vaccines. They're free and voluntary. And you can see here, we're just going to walk through some of the schedules of the immunization timeline. Vaccine dashboard, again, so this will be on the homepage of the Vaccinate Mono website. This graphic here just kind of shows you where we're at in the phases. There's 3 phases in phase 1, and then you can see we moved to phase 2 and 3. I'll give you some additional information on that in some slides. This is a screenshot of the dashboard. It shows you how many vaccines we've received for the Mammoth Hospital in Mono County, how many folks in our county have received the first dose, and we'll start to record and report how many of our residents are receiving their second dose. To expedite the distribution of the vaccines, we're encouraging all our residents to complete the confidential vaccine questionnaire. It is now live on the website as of about 20 minutes ago. So we do encourage you to pre-register yourself for vaccinations. This is the page that you'll see. It is confidential. The process here is essentially, once you complete this questionnaire, based on your appropriate phase and tier, on your age, occupation, your medical conditions, etc., You'll be then scheduled for I know I don't want to use scheduled too many times, but you'll be scheduled for your vaccinations. You'll actually be scheduled for your first dose and your second dose. So again, we encourage everybody to complete the Vaccinate Mono questionnaire. Again, this is now live on the website. You can see the URL is right there at the bottom of the slide. Just want to kind of walk through a little bit of the vaccination schedule. This is as per the CDC, FDA, and CDPH. This is the schedule that the Mono County Public Health Department is following. This is our Chief Medical Officer, Dr. Burrows, getting his vaccine on December 21st, scheduled to get his second one here soon. This just kind of walks you through phase 1A, tier 1, phase 1A, tier 2, and phase 1A, tier 3. And as you can see here, Brian and the world-class health department is almost complete with phase 1. These are all the different criterias. Again, this information is on the website. Phase 1B, tier 1 is up next. So you can see people aged 75 years or older with high risk of hospitalization, illness, and death should be completing the vaccination questionnaire. They'll also be they can also contact their healthcare provider for that information as well and ask to be scheduled. You can see we also will be vaccinating grocery store workers, restaurant workers, our many teachers from our school districts, colleges, and so forth, and then non-medical first responders, our law enforcement and fire personnel. This is phase 1, phase 1B tier 1. You can see phase 1B tier 2 there. Phase 1C, there's only one tier, so you can again kind of see the criteria and the occupations for this schedule. And then you can see phase 2 and 3 is kind of the larger general population. So Brian and his team are kind of estimating, based on the availability of vaccine, that phase 2 will commence in the spring of 2021 with, we hope, a completion through to fall. I'm sure there'll be lots of questions tonight on the vaccinations, and Brian is here to answer any questions. There is a comprehensive FAQ section on the portal as well. You can see here, these are some of the questions and answers we're providing for the public. And if you want to dig into additional information about the vaccine, please visit the CDC, FDA, or CDPH FAQs here as well. With that, I'll kind of wrap up the presentation. The next community conversation is scheduled on January 21st, 2021 at 5:30. And again, this is all the information that we have available to the general public. Brian, with that, I will send it back to you and see if we can answer some of these many questions the community may have this evening. So thank you.
Great. Thank you, Stu. And, we are really excited to have that live link for pre-registration for vaccine. And I do want to, give a shout out to our amazing IT team. Okay, so I see we already have a fair amount of questions in the queue. So why don't we go ahead and take our first question?
I don't see anyone counting how many people go in and out of Vaughn's in Mammoth. So how are they keeping capacity at 20% per the order? Is there any follow-up with management from the town or county?
Dan, would you be able to field that question?
Yeah, thank you. We've worked with Vaughn's management on the program of that. The state modified them to 35%. I forget the final number that's based on the occupancy tied to a fire code. It's quite high, actually. It's like in the, I forget the number, but it's like 150 or 200 people or something of that size. It's fairly large. Initially, they were given a number from their corporate office, which was actually the reduced amount to that 35% or 20%. And then they took another 20% of that. So they were down to like 90 people in the store, which was a substantial undercount. So at this point in time, that they do track it, they're watching that, but the actual number they're allowed in there is 35% of their maximum occupancy is allowed in the fire code. And if you want it later in the discussion here, we can put in the chat information. I will find the actual number that we're dealing with. Thank you.
All right, thank you, Dan. Why don't we go to our next question?
It has been reported that the town of Mammoth is considering a wink and nod agreement to the opening of restaurants and lodging. Is this not illegal? What is the panel's opinion?
Chief Freebold, can you start us off on this one?
If I can unmute myself, yes. Yes, I was on with the council meeting last night, and I'll certainly let Dan correct or supplement anything I would offer here. Purpose for council is to have open public discussion of government affairs. It was very clear that we had a lot of representation from the lodging and restaurant communities in particular, but I think all businesses. I mean, it is a tough time to be running any kind of business in Mammoth Lakes and elsewhere. Yes, there was open discussion. It's a matter of public record that there were requests for some kind of a reopening or relaxation of both restaurant capacities and lodging capacities. Those were brought up numerous times in discussion. The understanding I had from the meeting was that council had requested EOC staff to come back at some point next week with our best recommendations on how to manage the pandemic going forward. There were no decisions there made that I'm aware of, and I was there, and I'm certainly with the EOC, and we met today. Dan, is there anything you want to add to that or correct?
No, we've had that discussion. We had a roundtable discussion with the lodging community, and there was a number of issues that came up. One of those was, hey, just let us be able to do stuff and not enforce it. Those types of issues are to some predetermined level of activity. And so we're continuing to work through that. And there are elements that they can legally do in terms of specialized, like stranded travelers or essential workers and those types of elements. There's also just the practical side of that we do have, we believe, a fair amount of still illegal lodging going on that we're just not able to chase down. We do go after those that we know about. We are also seeing a lot of owners in town utilizing their property, which, as noted earlier in the presentation, is an allowed use. Thank you.
Thank you, Dan. And Chief, I believe you wanted to add something on.
Right. You try to learn to answer the questions that are asked and also the ones that probably aren't asked, but that are embedded in there. I think I actually saw in the question in the chat box there, it included, specific questions to some of the panelists. So I will answer on my behalf. If it was not clear from the council, I believe they all said they're trying to find a way forward. They're also trying to find a way to do that and not be in violation of the state. Tough balance. For me, I'll make the same decision that I did. We've done this before. We've had some tough shutdown times and tough discussions. As the fire chief, I couldn't support an intentional official act to step away from the state order. If I can make that any clearer to anybody, please let me know.
Thank you, Chief. Dr. Boo, would you like to add to this?
Not really. I think Frank and Dan have answered adequately.
All right. Thank you, Dr. Boo. Then we'll go ahead to our next question.
With the doubling of our numbers in the last 30 days, can Dr. Boo or Dr. Burrows comment on the new strains being discovered and if they think they have already reached Mammoth?
Doctors?
Yeah. Sure. It's Tom Boo, and it's just pure speculation. I honestly don't know. The increase in transmission is, it's widespread. It's certainly not localized to Mono County or town of Mammoth Lakes. I think some of it is attributable to, cooler weather and more indoor activity. I think we all feel that some parts of the community everywhere are less committed to following safety guidance, and whether those things by themselves are sufficient explanation. I think that's plausible, but I think it's also plausible that the new strain has reached here as well. We don't really know. I mean, California is doing some genomic surveillance. I mean, it has been identified in San Diego, and they're really ramping up their efforts to track these strains and look for other new strains that may develop. But honestly, basic answer is don't know. But I think it's certainly possible that it's reached us.
Go ahead, Dr. Burrows.
Yeah, I would add that as far as the new strain that's been discovered and is being identified in different parts of the state, if not the country, is frankly in a lot of ways an inevitability with viruses. That's what they do; they mutate. Right now, as the best information we have is that strain of the virus is not more of a health hazard than the one that we've been dealing with since this all started. And so far, as best as we know, we're able to detect that you are still infected with coronavirus or COVID-19, even if you do have the mutated strain. It remains to be seen what the virus is going to do with the course of time. And as Dr. Boo indicated, this is really the natural history of what a virus does. And with people moving around and the way things spread, if it's not here, it's not a question of if, it's more when. It will be here. And hopefully we'll see the same thing other people are experiencing, which is you don't get any more sick and it's not more of a health hazard, and we're able to detect it.
Thank you, Dr. Burrows. Dr. Boo, do you know how surveillance for this new variant is being conducted in California? Has there been any conversation?
Yeah, I don't know the details. I mean, there's actually some information shared on a call earlier today. Deb Watford, who you know from VRDL, was indicating that they've just received some additional funds. And so I think what they'll be doing in some kind of a systematic, maybe quasi-randomized fashion, but certainly making an effort to be representative of the different areas of the state. They will be reaching out to the different labs that are doing PCR testing to request submissions to the specialized labs for the genomic testing. There is also going to be an effort to create the capacity in more public health labs, like some of the larger county public health labs to do their own genomic sequencing. So I think it's a kind of a multifaceted approach with some resources.
Thank you, Dr. Boo. All right, let's go ahead and take our next question.
How is it okay for Mammoth Mountain to have outdoor seating and serve both drinks and food without it being supervised? Also, how is Mammoth Brewery allowed outdoor seating as well as serving drinks and food?
Dan, would you like to field that?
Thank you. The Mammoth Brewery had their picnic tables, I think, still set up out where they've had outdoor dining in the past. We've actually asked them to remove those to not be having a big outdoor dining area. The idea there is the outdoor dining is what has been eliminated by the state in that. It has nothing to do with, we've looked at that going, if there's some public tables there and there's no table service and somebody utilizes one, that's okay. I mean, they're not actually serving and managing the tables with servers. Mammoth Mountain has a little different environment there in terms of what we've heard from the state and their ability to operate their restaurants and be able to provide, again, the outdoor takeout type food, but there is no table service that they provide for that because of the outside dining restriction. Anybody can sit in those areas and utilize it, whether you're buying food or you're bringing something of your own. The element there is still a request that they still clean the areas and wipe the tables and make sure that there's still a cleanliness standpoint, but they're not to have any type of table service as far as assisting patrons in those areas. And we are looking at how much of the outdoor areas are actually allowed or how many tables are allowed, looking at making sure we keep social distancing, make sure we keep face coverings in place when they're not eating, and to the extent possible, limit that to the same households.
Thank you, Dan. I believe one of our attendees has their hand raised to ask a question. Why don't we go to that person?
All right. Sandra Carrillo, go ahead and unmute yourself.
Hi, I was actually one of the people that had a question on the outdoor seating. And is it valid to do? And what are the restrictions on that? An exact, not a percentage word, because I've heard a lot of throwing around numbers, 25%, 30%, we're not sure of the lodging. It's this number, that number. It's like, it seems like no one has a percentage that they know of, or they don't have like numbers that we should be sure of, and yet our town is closed and we are suffering from being such a small town and everything being closed, yet I don't see anything being done about it. Main Lodge has their patio completely full, and there's other few restaurants in town that has them as well, and they're allowed to be open, and I don't see any, not necessarily punishment. There's nothing being done about it, yet everyone else has to be closed, and I don't quite understand that. And I've lived here for 30 odd years, and I just want things to be explained more than anything. And I wait tables at a restaurant, so that's where I'm coming from.
All right. Thank you, Sandra. Dan, would you be able to field that?
Yeah, as we just mentioned, there actually is no percentage, especially of indoor dining. There's nothing that's allowed on the indoor side. The outside dining, as under the state order, outdoor dining has been closed also. What we do see is people do have some seats or some chairs or a table out there. They're more in a public space, not set up for dining. So there would be no table service. There'd be no waiting on those tables and service that way. As I mentioned earlier, we've received different types of, actually, I think 3 different levels of advice related to Mammoth Mountain and the ability to operate with some of the deck areas there in the outside. Tables and chairs, but not to be having, there should be no table service, no type of interaction with their staff other than staff there to manage for face coverings and those types of issues, making sure we have social distancing in place. And as I mentioned, some cleaning effort to the extent that tables are there. So it's not there is no set percentage or allowance of any of the restaurants or things to be open. We've had that request from restaurants and we have not moved any of that forward for any type of indoor dining. It's currently still not allowed.
Thank you, Dan. Before we go to our next question, I was hoping that Dr. Burrows could just give us an update on the hospital situation.
Sure. Currently, our hospital status is still in what we describe for the hospital, not for the county, as green. And what that means is that we're able to provide all services with the normal level of function that we would treat anyone on any given occasion for any condition. That means that if you require attention at the hospital, you can be cared for, and there's no concern that we don't have the resources to care for you in the way that we normally would. I need to emphasize to really everybody that's listening that, well, I'm going to start with the rest of the state and more specifically the southern region. The fact that we can call ourselves green and we can care for anything and we're still able to do elective procedures, I would count our lucky stars that that's where we're at right now. There are plenty of other places where they are completely inundated. So never mind, you can't have your elective procedure or your surgery done. If you decides the wrong way, but if you happen to have a medical issue that requires immediate attention, it's very touch and go if you're going to be able to get cared for, because they may simply not have room for you, or you may be in a hallway on a stretcher. So to me, I consider that to be extremely advantageous for our county and our community, that we're able to care for everybody without having to now make very tough decisions about who can and cannot be cared for. And transferring people out is equally difficult because all of these other larger centers are so impacted, not only by COVID, but also by just their normal business and the normal things that they see on a regular basis. So that is very fortunate as far as allowing us to maintain the health of our community. That is not a green light for the rest of the county to open up. And it could certainly be worse. It could be that we are in a yellow or red zone where we're now extremely compromised in our ability to care for people, in addition to all the restrictions that are currently in place.
Thank you so much, Dr. Burrows. Why don't we take our next question?
What phase of vaccination are Mammoth Hospital employees who work in the laundry department? Also, what phase of vaccination are CNAs who don't have work so they can come back to help out?
Laundry would be under, for the hospital, would be under essential services. Dr. Burrows, do you have direct laundry, or are you just using an outside company from in town?
We outsource it to a company in town. But
Right,
as
so-
far as really, boy, just about anything you can think of that's hospital related within the hospital, that's essential workers.
Sure.
So people that are working as environmental services or the cafeteria, cleaning different parts of the hospital, and obviously the people that are caring for patients in direct patient encounter, that's all essential high risk encounter potentially. And we have made every effort to vaccinate everybody that's in that situation.
And as for the outside company that you would use, I believe that would fall into phase 1B tier 2 under industrial, commercial, residential, I believe.
But without looking at the list specifically, I know they're not under jurisdiction of 1A as an essential health worker or
Right.
patient facing.
Right. And for CNAs who wouldn't be working, I still see that as an essential worker. And if we can get them vaccinated and back to work, that would be ideal. So again, I think that would be under phase 1B tier 2 as well.
Yeah, just looking at it, I think that's correct.
It's amazing that these tiers are stuck in my head. All right, why don't we go to our next question?
There were 29 positive tests reported yesterday, which is a significant jump. Any info on where case clusters are coming from? Are there cases being reported from Mammoth Mountain staff?
Let's see, Dr. Boo, do you want to field that one?
Well, I don't have the details of the latest cases, but their cases are pretty widely distributed. Mostly in Mammoth these days. That's where most of the testing's going on. But certainly Mammoth Mountain Ski area, as the largest employer in town, continues to have some positive cases. Yes.
Yeah, but as you mentioned, it is kind of widely spread these days. All right, thank you, Dr. Boo. Let's take our next question.
Do you expect the non-essential short-term rental prohibitions to change at all in the month of January? Is there a chance that Mona will be broken out from the Southern California region if the numbers are different than LA, etc.? There was a letter proposed to go to the state 2 weeks ago. Why has it not been submitted yet?
Frank, do you want to take the first part of that?
Yes, thank you. That's a great question. At present, the criteria of the stay-at-home order for our region, the trajectory does not look right. I just don't see that in the near term. There is some indication that the stay-at-home order is having impact on, I don't want to get too technical, but on something called the R factor, the reproductive factor for the disease, COVID-19. And we're starting to see that bend over a little bit, but the rate at which it would take the hospitals and the ICUs to clear the patients that are there and that are still coming from the holiday mobility. I don't see that changing in that time frame. And then as far as the letter, I know Dan can pick up the detail. I know we discussed it earlier today. There were some, I wanted to make sure that we got all that information correct, but my understanding is it's, I think it's waiting for maybe for signature is ready to go, but Dan has the most updated information on that.
Thank you. Yeah, the letter to the governor related to trying to have the Mono County outside of the Southern California region was just finalized today. And just during this meeting, I actually got confirmation that the final signatures were received. So it will be going out tomorrow morning.
Thank you, Chief. Thank you, Dan. Okay, why don't we take our next question?
Which does the medical community believe will happen first? 70% county infection rate or 70% vaccination level?
Which one of the doctors would like to field that one? Go ahead, Dr. Burrows.
I'll give you my opinion.
Sure.
Or my hope is that we get 70% vaccination. You know, honestly, the way things are going with respect to how quickly vaccines are being distributed and administered, it's going to be a horse race. And if we get to 70% infection rate, we're going to see a lot of people get sick and a lot of people die unnecessarily. The vaccination, winning that race is going to be very beneficial for a whole lot of people in this community, this state, this country, this planet.
Thank you, Dr. Burrows. Okay, why don't we take our next question?
What enforcement is being done on short-term rentals? We're not going to see any benefit from the stay-at-home order until people stop bringing the virus from LA, which we all know is currently inundated and overwhelmed.
Go ahead, Dan.
Sorry, follow up. Who do we contact to report and what is considered illegal?
Now go ahead, Dan.
Yeah, one of the slides that Stu had up has the contact information. He can pop that up in the chat for the call in or email in for illegal rental activity. There's information there both for the town and the county. Currently the illegal activity would be one that you know, people, if they're renting a unit or they're in a unit and they have traveled in opposition to the limit on the traveling requirement that's under the state order, and they are not an essential worker and they are currently renting a unit in town that's been rented out to them, that would be an illegal unit provided they have not met one of the qualifications at this point to be allowed to rent in the county or the town for that matter as an essential service worker, and a few other factors that go into that. Information to be put that we do go out, we check on those. The hardest part is there's a lot of owners in town that can legally utilize their units. In some cases, there's others that are there that are family members, but the owner's not there directly. And so we deal with some of those. A lot of that is just the amount of staff we have to actually go out and look at those areas. We do get complaints. We do try to follow up, but it is a significant task, and we do not have adequate people on board to go chase every single one of those. Or when we get a general complaint, hey, there's a bunch of people in my condo complex that I don't believe live here. That really doesn't help us go out and check on that. We try not to have to send a bunch of people out to go knock on doors and make them show ID and those types of elements. So that would be truly overwhelming in terms of trying to enforce that. We do ask people who are renting, especially on our hotel side, and they have been very cooperative. If there is a essential service worker, there's a definition for that. We have them fill out a form. We do confirm and check on those. And we've been successful in a number of those. Some have been turned away and not been provided a room. The vast majority coming in are legitimate that we do see, and we approve those as our various lodging operators are trained up in that area as well.
Thank you, Dan. Chief?
Just a quick add here. I want to really give a shout out to our town and county code enforcement team. I can tell you firsthand, personally, I know that they're punching way above their weight class here. They're short staffed. I mean, we all like to have, the smallest possible side of government on a regular time period. And right now it's particularly stretched. While we have expanded and done a number of emergency hires, almost all of those have been pushed towards the public health side for contact tracing, for testing, and now for immunization. So I want to reinforce that the small group that is available, and they're the same ones that help the businesses get open by pushing out PPE and helping them open up. They are responding to the complaints. It may not be as fast or as responsive as you'd hope, but it's about the maximum balance they can get to. And I firsthand, I'll say I know that they're doing everything they can do.
Thank you, Frank. Sorry. Thank you, Chief. Why don't we go ahead and go to our next question?
Can Dr. Burrows speak to the surge of ICU beds to 3 and then back to 2? Not asking for specifics, but just how that happened and how we stayed green when we went beyond the normal 2 beds.
I have to say, I'm not sure what the question is referring to as far as ICU beds are concerned. We have had, oh gosh, 1 or maybe 2 ICU beds that have been occupied, but our surge capacity is for upwards of 10 ICU patients, and we have really not even come close to crisis level of care.
Thank you, Dr. Burrows. Are there currently ICU patients? Is that something you can answer? Or?
There, at present, no, there's not. And Chief Freevault is questioning, and I guess I am as well. Are we referring to NIH or are we referring to Mammoth Hospital?
Right, that's a good point. Dr. Boo, do you have any updates from NIH possibly?
No, my information is a day or 2 old. I mean, I think they had about 10 COVID patients. I think a couple were on ventilators. It's definitely a more serious, daunting situation there. I mean, it may have already been mentioned, but Frank and Chief McCrasick from the EOC were able to provide some oxygen concentrators this morning to Northern India that they were requesting. So.
Thank you, Dr. Boot. Chief Freevault, you had turned your mic off. Did you want to articulate something?
No, just to confirm that, yeah, there was a request. We were able to fill out our inventory. I don't know the details on it. I do know that they've been quite busy there.
Sure. Thank you all. All right, let's go to our next question.
Have we determined what constitutes food workers with respect to vaccine distribution tiers?
So food workers would be, so under food and agriculture, that would be, first the agriculture part would be, anyone that, potentially is, works at a ranch workers. I know we do have some ranch land in the county. Oops, Stu's pulling something up here. But as far as food, yeah, it's going to be grocery stores, restaurants, and Vaughn's obviously grocery outlet. I think there are some smaller food markets. I believe there's one in Lee Vining. So that would be that category. So it'd be restaurant workers and grocery stores. I think that hopefully answers the question.
Thank you.
And a lot of this information too, sorry, Brian and Lauren, is on the portal. So again, I want to direct everybody to the Mono County COVID-19 portal. Click on the vaccination logo there. You can see right at the top right-hand corner of the screen. And there you go. Just click on where we are in the little dashboard and it'll take you to all this information. So thank you.
Thank you, Stu. All right, let's go to our next question.
Circling back to the outdoor dining question. So the brewery needs to get rid of their tables, even if they don't have service to table, but the mountain can keep tables. Is that what you're saying?
Dan, are you able to field that one for us?
Basically, yes, there's the brewery. We've asked them to remove those. I mean, if they end up with one out there for people to sit and wait and get takeout and those types of elements. But Mammoth Mountain has been, again, addressed differently under the outdoor recreation from information that we've currently received from the state. So they do have additional tables out there in terms of that service. We're continuing to pursue that and review that. But at this point, yes, there is a difference.
Thank you, Dan. I see we do have one of our attendees with their hand raised. Why don't we go to them?
Okay, Galaxy Note 10 Plus, please go ahead and unmute yourself.
You're still on mute. Okay, why don't we try coming back to, oh, wait, go ahead.
Sorry, I accidentally pushed a button.
That's all right. I know the feeling.
Do you
So
have a question?
No question.
Okay. All right, let's go to our next question then.
Would code compliance be willing to publicize short-term lodging violations and the penalties in the newspaper so as a community we feel heard?
Dan?
No, we have not really done that in the past. There's always been some issues about that type of information that we work with and some confidentiality issues we deal with, especially with short-term lodging. So we have not advertised or posted those various properties that have been under review and actually issued a citation or a fine of some sort. The ones that become public are those that appeal those types of actions to the town council, and those are a public record in the town council component. But otherwise, no, we do not publish that activity.
Thank you, Dan. Why don't we go to James Sanford? Attendee James Sanford. Hi, James. Go ahead and unmute yourself.
All right, can you hear me okay?
Yeah. How are you tonight?
I'm good, and I want to commend you all for participating in these chat sessions, and all of you. I mean, you're very patient, and you're dealing with a number of questions that have been previously asked, and you answer them straightforward as if it's the first time you ever saw it. So thanks an awful lot. My question is pretty simple. We have marginal snow conditions. We have a 14-day forecast that doesn't reflect any snow. The mountain's cash flow is got to be just barely covering its current expenses, but it still acts as a magnet for people from Southern California. Have you guys talked at all about a decision plan for when we're going to actually close the mountain?
Chief and Dr. Boo and Dan.
I'll kick it off. Two different things there. Yeah, we were looking at that same forecast, and we do have concerns, not just from Mammoth Mountain standpoint, but for longer term drought conditions here in the Eastern Sierra, and what that means for us from a water content and fire danger. But Mammoth Mountain, we've had those discussions. It's at least been looked at some level. The primary ability to close Mammoth Mountain has been challenging because in the state order, and very specifically announcements by the governor, was that outdoor recreational facilities would be remained open, and that included areas that provide skiing and snowboarding, et cetera. So they are very directly called out as being allowed to operate and be open through this state regional stay-at-home order that we're currently under.
Dr. Boo?
Yeah, I mean, just to add to what Dan said, I mean, I think it's a very legitimate concern and in a very challenging situation because it is so important to the economy of our area. Have absolutely thought about and discussed, you know, not just closure, but also capacity limits on the mountain. Their use is, as you say, not high right now, but week to week, watching the trends in local transmission metrics, rates, and struggling to find the right balance. I mean, if things, you know, we do expect to see increase in cases and positivity rate after the winter holidays. Kind of endured, you know, the bump after Thanksgiving, and maybe you know, maybe we can survive another. But if things seem to be inexorably increasing, yeah, it's on the table, but wouldn't be a decision undertaken lightly.
Thank you, Dr. Boo. Go ahead, Chief.
Yeah, just to tag on to Dr. Boo and Dan here. If you sit in enough of these meetings, you realize that we have a lot of competing interests that everybody wants us to balance on the head of a pin, understandably. This is a financial crisis. It's a public health crisis. It's a social crisis all at the same time. And if you remember back, we can throw a few fire emergencies and disasters right in the middle of all of that. Nobody's going to ask our permission on those. We have had this discussion in earnest and on the table and on the edge of the table for some time. We've also been trying to use, you know, talking about the 14-day forecast. We all understand forecasting from the weather, and we're doing our very best to use forecasting information to make the most balanced decisions as possible. And so we're right on the edge with those things. It's difficult globally, really, to come out of a holiday period and look at your metrics because they're all over the place in terms of breaks in the holiday, labs shutting down, disruptions to testing. We've seen that locally with both smoke and snow conditions. And so you want to be careful not to overreact to short-term trends, but you don't want to be slow to react to long-term trends. We are looking at every forecasting tool out there to us, and I believe we're rapidly coming to some important decision points, as you heard in council last night.
Thank you, Chief. Well, we are almost out of time. I think we have time for one more question.
Oh man, the pressure. Is it true that 75% of vaccines available in California are still in warehouses?
So as far as, you know, the vaccine getting into individuals' arms, there is at times delay, but there's also data delay. So I don't know if that number would actually be correct. I know that they were reporting that only 30% of vaccines that have been allocated and given to counties have been administered. And in Mono County, we are ahead of that curve. We are, you know, over 50%, and it was actually a much larger percentage until we got more vaccine in today that we will immediately start pushing out. You know, that is our focus right now, is to get shots in arms and to get the vaccine out of our freezers and to the community. So that is our goal. Yes, there's probably been some delays in some areas in some counties. Having listened in on some of the state calls, some of the larger counties are really struggling to get through phase 1A, and we're already, you know, well beyond that. So we are in pretty good shape as compared to some of the larger counties, and that is just something unique to our county and, you know, just our population base. Go ahead, Chief.
And just real quick, I want to super emphasize this. Please help us get you immunized. We're going to, Brian is begging and borrowing at every turn at the state to get us a larger allotment than the normal system would allow. He's pushing hard on that. I'm going to help him with some other requests for that, because I think we can utilize vaccine in a way that's being underutilized in other areas. We'll try to make that argument. And just please help us to help you. If you have questions about getting immunized, we've got a lot of information. Reach out to anybody on the panel here and we'll get you questions, get your questions answered. Getting immunized is our fastest, best way to get out of what we're all describing as an untenable situation. So please help Brian and Dr. Burrows and their teams. Let's get this thing done. Get registered, go to the sites that Stu showed you. That's it. If you've got pent up energy on something, let's put it towards getting immunized. That's our best step.
Thank you, Chief. And again, I'll emphasize, go ahead, Dr. Burrows.
I was just going to say, we've been extremely successful in vaccinating our 1A population, which means we can move on to the next set of tiers. And as Chief Revald said and Brian said, please get yourself registered, get in line, get vaccinated when you can. Don't make the delay because you didn't sign up. If it's because of us and our system that the delay occurs, we are working as hard as we can to try and facilitate a vaccination clinic that will quickly and effectively get everyone vaccinated. But if it's because you and members of the community are not signing up and coming and getting vaccinated, there's not going to be a lot we can do.
Thank you, Dr. Burrows. Go ahead, Chief.
I would just say I looked like this before the vaccine, so this is not a byproduct. I felt fine. So yeah, get out there, ask your questions, and let's get this immunization thing done. That's our way forward.
All right, thank you so much. Well, that's about all the time we have for this evening. So until we see each other again, take care of yourselves and each other. Good night, Mono County. Happy New Year.
Thank you.